Docturnal is a point of care, non-invasive, real-time diagnostic and screening provider for lung-based ailments, which behind the scenes leverages machine learning, spectral analysis, deep learning to diagnose and screen for tuberculosis. That's our flagship product, and that is titled as Timber. And it's just not about tuberculosis, we also screen other lung-based ailments such as asthma, COPD, and pneumonia. Docturnal was incorporated in the year 2016 of April, and we've been bootstrapped for the first 8 months, post which we got selected for Avishkar Deeptech program from CIE Hyderabad. And around that time, we partnered with RNTCP Hyderabad, which is revised National Tuberculosis Policy, who would introduce us to different public health centers and patients who are already undergoing tuberculosis treatment. And that was our original data harvesting exercise, post which we partnered with Telangana State Government Chest Hospital, which is again under the umbrella purview of RNTCP. And we accumulated more volume of data for our machine learning and deep learning, and this was all labeled data. In the interim, we also received biotechnology ignition grant from BIRAC, and we also were a part of AirMaker, which is a Singapore-based accelerator. By virtue of that, we also incorporated a company in Singapore with the same name. Most recently, 2018, we raised an angel round from Mumbai Angels. So we work closely with public health specialists, mostly connected to the government. Now we are also exploring other markets such as COPD and asthma, which are pretty good business areas for big pharma and clinicians operating across tier 2, tier 3 and also tier 1 cities. Dr. Suryakant Shetty has been a mentor since Avishkar Deeptech. By virtue of the program, he kind of accepted to play the role of a mentor. And our journey, it was great learning, sitting with him and talking about spectral analysis and so on and so forth. However, what is more relevant and important here is he would visit the government chest hospital, interact with the patients there. That gave us enough confidence, and he would often intervene and encourage us that we are going in the right direction. That was all during the tuberculosis screening era. Now that we are now getting into bigger challenges like screen more than 2 lung-based ailments such as COPD, asthma, pneumonia. So there's a lot of sound and physics, spectral analysis involved there. And it is also from his lab that we have leveraged some sort of noise reduction algorithms, and we have incorporated that as a part of our solution. So we are really looking forward to a more meaningful and a deeper association with Professor Suryakant Shetty.
I am Dr. Suryakant. I am a faculty member in IIIT Hyderabad since 2006. I work in the area of speech signal processing. Basically, we address some of the issues related to speech recognition, speaker recognition, language identification, emotion recognition, and accent recognition in Indian scenario. I am advising to a startup called Docturnal, and they wanted to develop machine learning approaches to identify whether someone has cancer or not by collecting the cough samples from it, and that is also a challenging task that rightly we are guiding. And apart from this, we are interested in collecting large data from open population, that is called unrehearsed spontaneous speech from open population, because quite number of times when you collect the data systematically, that may not be useful, because naturally when somebody speaks, it is like it is in a unorganized, unrehearsed manner. This is what we are doing in our research.
My name is Sekhar Jha. So I'm the Chief Scientific Officer at the Docturnal. So basically I'm qualified bioinformatician, especially in genomics. And Docturnal I do the machine learning and the other progression into MDR work and others. Yeah, so if you look at the tuberculosis as a disease and the detection of the tuberculosis disease, so there has not been any point of care diagnosis till now before Docturnal. So the earlier, because the bacterial disease, infectious disease, so we have to culture the bacteria, see them under the microscope. So it's not only the time, and there was a requirement also needed. You need a lab, you need trained people to support. So this has actually transformed that people requirement, their dependency on the trained professionals and the lab requirement and all. Now you can do it anywhere, any you want, which was not possible earlier for the medical community. So the other part of this data that we have grows, it's not just for the TB detection through voice and the other clinical and demographic variables. So what happens, there is a pattern for as the TB grows and the patient who doesn't come out of the disease or not cured at the proper time, they go into resistant type bacteria. So more and more antibiotics starts failing on them. So the same data with the more included data, we think we can grow the product into a detection where we can also detect the patient has an resistance or antibiotic resistance or not, and we can help in the prognosis or changing in the antibiotic also or not. So that can be the next step where we can help the medical community again, besides just building a point of care diagnosis for tuberculosis.
Right now, our focus is to implement pulmonary tuberculosis screening pan-India, and parallelly we are working on COPD and asthma. We are running clinical trials for tuberculosis at Mazumdar Shah Medical Foundation and Narayana hospitals, Narayana Hrudayalaya hospitals, which we got introduced by virtue of us completing our, we are a cohort of Axelar Ventures in the summer of 2018. With this arrangement, we are continuing our clinical trials for pulmonary tuberculosis, and now that we are talking to a big pharma who want us to run clinical trials for asthma and COPD, that would be our next step, followed by pneumonia, and if situation permits and if we have promising results from these clinical trials, we would also look at lung cancer.
So the first phase is the good place where you come and sit and work regularly. It builds the discipline into you. It's different from working from home. That is one of the first steps that CIE helps a lot. Second is the environment where you have people around you. You can talk about their startups and all. Then their mentors like Professor Surikant Sethi and all. And overall the environment plus the money also that we got through Aviskar and all. So it has been made the startup more journey, has just made the journey more easy for sure.